G'day everyone, welcome to Community Care Channel. We all know Australia is home to stunning landscapes and unique wildlife, but did you know it's also a world leader in public health? Today, we're diving into 5 standout success stories that can inspire countries worldwide. We'll be exploring their incredible HPV vaccination program, their pioneering needle and syringe program, and their hard-hitting smoking control programs. We'll also look at their efforts to combat obesity and their proactive approach to tackling skin cancer. So buckle up, because we're about to embark on a journey through 5 impactful public health initiatives that highlight what can be achieved with dedication, innovation, and a commitment to the well-being of a nation. Let's talk about a vaccine that's not just preventing a disease, but potentially eliminating a cancer entirely. Australia is on track to be the first country in the world to eliminate cervical cancer thanks to their HPV vaccination program. Back in 2007, Australia introduced the HPV vaccine for girls in their preteen years. They recognized that vaccinating girls before potential exposure to the virus was key to preventing HPV-related cancers later in life. They extended the program to boys a few years later, understanding that a comprehensive approach was crucial for maximum impact. As of 2021, about 80% of eligible teenagers in Australia have received the full course of the HPV vaccine. This widespread vaccination coverage has led to a dramatic reduction in HPV-related infections and a significant decline in cervical cancer rates. Australia launched comprehensive education campaigns targeting young people, parents, and healthcare providers. They tackled misinformation head-on, addressing concerns and highlighting the vaccine's safety and effectiveness. This community-wide effort, combined with easy access to the vaccine through school-based programs, has made Australia a global leader in HPV prevention. Australia's HPV vaccination program is a testament to what can be achieved when governments, healthcare providers, and communities work together. Now let's talk about a public health challenge that's often surrounded by stigma and misinformation: HIV/AIDS. Back in the 1980s, when the world was grappling with the emergence of this devastating virus, Australia chose a different path, a path paved with compassion and a commitment to harm reduction. They knew they had to meet people where they were at, providing practical solutions that could actually save lives. This is where their groundbreaking needle and syringe program, or NSP, comes in. Introduced in the late 1980s, the NSP was founded on the principle of harm reduction, recognizing that providing sterile injecting equipment was crucial to prevent the spread of HIV among people who inject drugs. It was a bold move, met with resistance from some who argued that it condoned drug use. But Australia stood firm, guided by science and a deep sense of empathy for those most vulnerable. The NSP has been instrumental in driving down HIV transmission rates among people who inject drugs by a staggering 95%. By providing clean needles, syringes, and other harm reduction supplies, Australia has not only saved countless lives, but also significantly reduced the burden of HIV on their healthcare system. The NSP is about building trust and connecting with marginalized communities, offering a non-judgmental space where people can access healthcare services. Australia's needle and syringe program is a shining example of how a compassionate and pragmatic approach can make a real difference in the fight against HIV/AIDS. Chapter 3: Clearing the Air, Australia's War on Smoking. Let's talk about a public health battle that's been fought on many fronts: the fight against smoking. Australia has really taken a stand against this global epidemic, implementing some of the toughest tobacco control measures in the world. One of their most impactful initiatives has been the introduction of plain packaging laws back in 2012. Gone were the days of flashy logos and enticing designs on cigarette packs. In their place came standardized drab green packaging adorned with graphic health warnings. This bold move was all about taking away the allure of smoking, especially for young people. Studies have shown that plain packaging has been effective in reducing smoking rates, particularly among young adults. Australia coupled plain packaging with significant increases in tobacco taxes, bans on smoking in public places, and comprehensive public awareness campaigns. These campaigns graphically depicted the devastating health consequences of smoking and challenged the social acceptability of this deadly habit. Smoking rates in Australia have plummeted from 24.5% in 1991 to just 11.6% in 2021. It's estimated that these initiatives have prevented more than 300,000 smoking-related deaths. Australia's fight against smoking isn't just about legislation and regulation. It's also about providing support for those who want to quit. Australia's comprehensive approach to tobacco control is a model for the world. Chapter 5. Crunch and Sip: Building Healthy Habits Early. While Australia has made significant strides in combating obesity among adults, they're also focusing on the younger generation. One of the standout initiatives is the Crunch and Sip program, designed to instill healthy eating habits in school children. Launched as a part of the broader effort to tackle childhood obesity, Crunch and Sip encourages kids to bring fresh fruit, vegetables, and water to school for a daily break. This simple yet effective program has been integrated into the school day, providing a structured time for students to refuel with nutritious snacks and hydrate. The idea behind Crunch and Sip is to make healthy eating a routine part of children's lives, helping them develop positive habits that can last a lifetime. Teachers play a crucial role by incorporating lessons about nutrition and the benefits of a balanced diet into the curriculum. The impact of Crunch and Sip has been promising. Schools report that children are more focused and energized, and there's been a noticeable increase in the consumption of fruits and vegetables. Parents also appreciate the program, as it reinforces healthy habits at home. By targeting children with programs like Crunch and Sip, Australia is laying the foundation for a healthier future. This initiative not only addresses immediate nutritional needs, but also educates the next generation about the importance of making healthy choices. It's a vital piece of the puzzle in the fight against obesity. Australia's comprehensive approach to public health, from school programs to national campaigns, continues to set a high standard for the world. Chapter 6. No Hat, No Play: Fighting Skin Cancer Early. As part of Australia's comprehensive approach to public health, the No Hat, No Play program stands out as a critical initiative in the fight against skin cancer. Launched to protect children from the harsh Australian sun, this program mandates that students must wear hats when playing outside during school hours. The importance of wearing hats cannot be overstated. Australia has one of the highest rates of skin cancer in the world, largely due to the country's high UV radiation levels. By instilling the habit of wearing hats early, No Hat, No Play aims to significantly reduce the risk of skin cancer in future generations. Schools across Australia have embraced this program, integrating it into their daily routines. Teachers and staff ensure that children understand the risks associated with UV exposure and the benefits of wearing protective clothing, including hats. The program also encourages the use of sunscreen and seeking shade during peak sun hours. Parents have been overwhelmingly supportive, appreciating the focus on their children's long-term health. They've noticed a positive change in their kids, who are now more mindful of sun safety, not just at school but also during outdoor activities at home. No Hat, No Play is more than just a rule. It's an educational tool that promotes lifelong habits. By making sun safety a priority from a young age, Australia is taking proactive steps to combat skin cancer. This initiative is a testament to the country's commitment to public health and its innovative approach to preventing disease. With programs like No Hat, No Play, Australia continues to lead by example, showing the world the importance of early intervention and education in the fight against skin cancer. Chapter 4. Fighting the Obesity Epidemic: Australia Steps Up. Obesity is a global health challenge, and Australia is no exception. They've taken it head-on, implementing innovative programs and policies aimed at promoting healthier lifestyles. One of their most notable initiatives is the Live Lighter campaign. Launched in 2013, this hard-hitting campaign tackles the issue of unhealthy weight head-on, encouraging Australians to make healthier choices. Live Lighter uses striking imagery and powerful messaging to drive home the point that carrying extra weight can significantly increase your risk of developing serious health problems. The campaign also provides practical tips and resources to help people make positive changes. They've got healthy recipes, meal planning guides, and exercise tips, all designed to empower Australians to take control of their health. Australia recognizes that tackling obesity requires a multi-pronged approach. They've implemented government regulations on food marketing, particularly to children, and have invested in community sports programs and school initiatives. While obesity rates in Australia still hover around 27.4% in adults, these targeted programs have led to positive lifestyle changes in many communities. The Live Lighter campaign has been successful in raising awareness about the importance of healthy eating and regular exercise. Australia's fight against obesity is a marathon, not a sprint. Chapter 5. Sunburnt Country, Sun-Smart People. Australia's Skin Cancer Front. Australia has one of the highest rates of skin cancer in the world, but they haven't let this daunting statistic define them. Instead, they've become world leaders in skin cancer prevention, launching comprehensive public health campaigns. Their message is simple, clear, and catchy. Slip, slop, slap. Slip on a shirt, slop on some sunscreen, and slap on a hat. This iconic slogan, first coined in the 1980s, has become ingrained in Australian culture. Australia's commitment to skin cancer prevention goes beyond catchy slogans. They've invested heavily in early detection programs, making it easier for people to get their skin checked for suspicious moles or lesions. They've also implemented educational programs in schools, workplaces, and communities across the country. These programs emphasize the importance of seeking shade, wearing protective clothing, and applying sunscreen regularly. Australia has also implemented policies aimed at reducing UV exposure in public spaces. While Australia still has a long way to go in the fight against skin cancer, their proactive approach has undoubtedly saved countless lives. Australia's story is a powerful reminder that we have the power to protect ourselves and future generations from the harmful effects of the sun. I'm sure you've heard the news. Dr. Mike is a leading expert in public health innovations. 5 incredible public health success stories from the land down under. From tackling cervical cancer and HIV to combating smoking, obesity, and skin cancer, Australia has consistently demonstrated its commitment to improving the health and well-being of its people. These successes offer valuable lessons for countries worldwide, showing that with dedication, innovation, and a focus on prevention and early intervention, we can overcome even the most daunting public health challenges. Let's learn from Australia's example and work together to create a healthier future for all. Now I want to hear from you. Which of these public health initiatives resonated with you the most? Let me know in the comments below, and don't forget to like, subscribe, and share this video with your friends. Until next time, stay healthy.